Hey everybody, happy Monday. I wanted to talk about National Diabetes Awareness Month, and so I think it warrants a video. So November is National Diabetes Awareness Month, and 1 in 9 women will develop diabetes at some point in their lifetime. So it's a pretty important issue for us to consider as women. And I want to talk a little bit about some things that can affect your blood sugar and the top 5 risk factors to consider when it comes to your likelihood of developing diabetes at some point in your lifetime. And then later this week, I'll do a live on Wednesday evening and just share a few best practices for how to use food as medicine to eat in ways that keep your blood sugar balanced and reduce that risk. Okay, so diabetes, in its simplest, most layman's terms, is really an imbalance in blood sugar. Your pancreas releases a hormone called insulin, so that when you eat things that are converted to sugar or have sugar in them, that insulin is a messenger and it tells your cells to soak up that glucose and use it as fuel, as opposed to that glucose or sugar just simply remaining in your bloodstream and circulating around in your system, which can cause problems. That is a state of high blood sugar when that sugar does not get soaked up by those cells. Over years of things like stress, hormonal imbalances, polycystic ovarian syndrome, and most commonly known diets that are high in carbohydrates, sugars, or processed foods, all things that are converted to high levels of sugar in the body, the pancreas can get stressed out. And it doesn't operate in a way that is regulated and becomes irregulated, essentially. And so sometimes it releases too much insulin, sometimes it releases not enough insulin, and then sometimes the cells are so overwhelmed with constantly being flooded with insulin because we're not eating in the way that we should, or stress is elevating our insulin levels, and it just is always pushing out insulin to where they become desensitized to the message that the insulin is trying to tell the cells to soak up the glucose, and they are just no longer responsive to that signal. That is called insulin resistance. And so any of these situations can cause a scenario in which the sugar is no longer being properly absorbed by the cells, and or the cells are overwhelmed and the body is overwhelmed with the amount of sugar that it has to process and does not respond to the direction that the insulin is giving the body, and therefore the sugar remains in the blood and you have what we know as high blood sugar or diabetes. This does not happen overnight. It takes years to develop, but there are 5 key risk factors that women in particular should consider to minimize our risk. So one is having polycystic ovarian syndrome. It is one of the most commonly underdiagnosed or misdiagnosed hormonal imbalances, and it is clinically shown that women who have polycystic ovarian syndrome are at much higher risk for diabetes or insulin-driven issues. Secondly, menopause. So menopause is really almost like going through puberty in reverse, but you've got so many fluctuations happening in your body as your insulin levels begin to become more erratic. Changes in insulin levels, estrogen levels, become more erratic. Changes in estrogen can trigger changes in how your insulin responds as well. Remember, your hormone system is like a domino effect. So when one tips over, the rest of them begin to tip over as well. And so changes in your female hormones can also trigger changes in your insulin response as well. Family history. If you have a family history of diabetes or blood sugar issues, it can put you at higher risk. If you eat a diet high in processed foods, sugary foods, or high carb foods, I often say the white diet, so white bread, white rice, white pasta, all of those are foods that have a very high, what you call glycemic index. That means as the food is processed and broken down in your body, it is turned into large amounts of glucose that can overwhelm the pancreas, whose job it is to respond to process that sugar out of the body, and it simply overwhelms the cells in the body, and it's hard for the body to get all of that sugar out of the bloodstream, and so it just kind of remains there. And then the last risk factor is stress. So as I mentioned before, that domino effect, when one part of the hormone system kind of gets off balance, it pulls others with it. So your body's stress response, if you're under a lot of stress, your body is constantly pumping out that stress hormone to keep you alive. Well, guess what? High levels of stress hormone can also increase your body's insulin response or blood sugar as well. So those are 5 things to consider when you're evaluating your own risk factors for higher blood sugar amounts or diabetes. And stick with me this week. Join me on Wednesday for some tips on how you can use food as medicine to minimize that risk. Happy Monday.